Ladies and gentlemen, I present to you Lithium Masterclass in Psychiatry Medicine. I'm Dr. Tettey Doe, Psychiatry in United Kingdom. And I'll be covering the following in this presentation: indication for lithium, how to monitor and the side effects, contraindications, interactions, and lithium and travel, and the thyroid gland. Lithium is indicated or prescribed for the treatment of conditions such as bipolar affective disorder, in mania, hypomania, recurrent depression. It has been tried and tested and used for many years. There are 2 periods of illness in 2 years, and also 2 periods of illness in 5 years that lithium is indicated for. Now, there's tolerance and monitoring required because lithium has what we call a narrow therapeutic index. That means the therapeutic dose and then the dose which is above the therapeutic dose, the toxic dose. There's a narrow, just a small difference, so it needs to be monitored, which I'll come to. And the blood test of the drug level is very important. Kidney function test, thyroid function test, and ECG are all important as baseline and as part of monitoring. The side effects of lithium include what are the common side effects: stomach cramps, diarrhea, tremors, mild thirst, and urine in large volume and frequency. There's also weight gain. Dehydration is a factor, a side effect, so one needs to drink a lot of fluids. There are some contraindications: renal problems, thyroid problems, cardiac disease, sodium imbalance, example in Addison's disease. There are some drug interactions. Lithium interacts with diuretics and non-steroidal anti-inflammatory drugs. These cause lithium toxicity. Lithium and travel. There's a need for a medical declaration on travel insurance, and during travel, drink a lot of fluids and avoid alcohol. And usually a medical alert bracelet is recommended for those who are on lithium and traveling, so that they can be supported in case they have any complications during traveling. Now, I'll talk about lithium and this important thyroid gland. So lithium and hypothyroidism. Hypothyroidism is usually treated with levothyroxine, which is in the form of tablets. And symptoms of hypothyroidism, which is low functioning thyroid, lack of energy, cold intolerance, slow thoughts and actions, hoarseness of voice, weight gain, the hair and the skin texture changes. There are pins and needle sensations, constipation, and depression. Now, the thyroid gland, I'll talk a bit about examination of the thyroid gland for the purpose of those who are doing exams and for students. Examination always starts with permission. You need the consent of the patient. And you start with inspection. Inspect the neck, that the thyroid from in front. Inspect the eye from the side and above. Ask the patient to drink water and watch the thyroid. The next stage is palpation, where you feel the neck from behind and to the right. The thyroid right and left lobes are felt, and ask the patient to swallow. Feel for the lymph nodes. The next is percussion, and the next is auscultation, where you listen with the stethoscope for any thyroid lobe breathe, and also the chest auscultation for any arrhythmias. And the next is an ankle check for ankle reflex, and at the same time edema of the ankle. Various investigations that can be done: ultrasound of the neck and the thyroid, CT or MRI, radioactive thyroid scan, fine needle aspirate biopsy, chest x-ray. And these are the investigations. Also in the NICE guideline, recommendation for treatment of bipolar affective disorder, one is to continue lithium for at least 6 months and aim at a range of 0.6 to 0.4 millimoles per liter, or 0.9 to 1, not exceeding 1. If you are stopping lithium, consider atypical antipsychotic for bipolar affective disorder and monitor for depression and mania. Now, the thyroid gland itself, as we have mentioned during the examination, just to recap, is to inspect the neck, ask patient to swallow water, and then go to the back of the patient and palpate the tracheal, below, and thyroid cartilage. Then to the sternocleidomastoid area, and palpate again with swallowing. The thyroid is soft, firm, or nodular. Document that. Palpate for lymph nodes, which are the supraclavicular, submandibular, and suboccipital. Auscultate the gland for a breathe, and also cardiovascular examination to rule out cardiac failure. So these are the examination of the thyroid gland, and check for inspection, weight. These are general. Look for pallor, exophthalmos, edema, whether the skin is dry or flaky, alopecia, that's hair loss, and the composure, whether the person is slow, lethargic, fidgety, or restless. And wash the hands for pulse and the palm, the temperature, whether it's sweaty, and then get the patient to stretch their hands and look for fine tremor by putting a piece of paper on the back of the hand. Stretched. Ankle reflex, whether it is slow, relaxing. Eye movement for exophthalmos, lid lag, and lid retraction. So these are the important things that one needs to look at in examination of the thyroid gland. And I wish you all the best. In your studies and your career.